Good afternoon. My name is Shaloida Hewlett, Marketing Officer of the Sinkies Cooperative Credit Union. Welcome to our Community Mental Health Awareness Forum. Today we have Mrs. Michelle Blake, our guest speaker, the director at the National Counseling Center, and she is here with us to present on anxiety and depression as a part of our credit union week of activities. We thought that this topic was so fitting as persons out there may be going through um, mental health issues and they're not even aware. We know that the pandemic would have and is still affecting most of us. And also, we know that it was International Mental Health Awareness Day, October the 10th. So it was just very fitting for us to choose this topic. And we have Mrs. Blake on standby. She's going to present for us. So without further ado, we will take you straight into Mrs. Blake's presentation. Welcome, Mrs. Blake.
Okay, thank you, Ms. Hewlett, and good afternoon to all those people who are listening or looking at us here this afternoon. And as Ms. Hewlett indicated, we just came off of Mental Health Week. World Mental Health Day was October 10th, and that is celebrated annually for there to be a raising of awareness of mental health issues. So this is very timely and very fitting. I chose to speak today about depression and anxiety, which are two very much co-occurring disorders in the world of mental health. And I chose to speak about them because of the fact that there is so much going on in our world today that is contributing to elevated levels of depression and anxiety. And I'm going to speak about depression and anxiety, not sadness and worry, because sadness and worry are normal things that happen in normal life situations. Depression and anxiety, as I'm going to speak about it, are situations that impact a person's life, and so we're talking about mental health disorders. All right, so today when we are talking, I'm going to describe the mental health disorders, anxiety and depression, as I said. Why do I focus on these? Why am I going to focus on these? Because of the potential for impact on day-to-day life that these have. I'm going to look at the symptoms of each one. I'm going to look at some of the causes and the treatment and end up with some words about self-care. So why are we going to look at these? The most prevalent mental health disorders worldwide and in the Federation are depression. And as I said, anxiety often co-occurs with it. Depression occurs worldwide in 1 in every 10 persons. So that means that most likely there's going to be someone in your close circle, someone in your family, someone with whom you work, someone with whom you go to school that will suffer from depression, from clinical depression. So as I said, they're coexisting disorders, so I'm going to talk about them together. The thing about depression and anxiety, though, they are usually very responsive to treatment, including medical treatment, support system, and psychotherapy. So even though, we think about depression and anxiety as something that is very prevalent, it's also very responsive to treatment. And we're going to look at the fact that it's evident in all age groups in society. So depression and anxiety doesn't just affect older people, doesn't just affect a particular group of people. It affects everybody, or could affect everybody. So again, it's something timely for us to discuss because it's relevant to just about any and everybody. So mental health disorders and their impact on life. Now, when we have people who have physical disorders, they could be seen. So you could see someone who is suffering from some sort of physical ailment, or they could describe it to you in a way that is clearly understood. But mental health disorders are usually a little bit more unseen and a little bit more silent as they, in the impact that they have on somebody, because they are usually, people prefer to keep those things quiet and silent, and so a lot of times people suffer quietly. But because of that, then, they can cause alienation and isolation from social systems. Because when people want to keep their struggles quiet, one of the ways that they do that is they step back from the social circles and social systems that feel burdensome to them. To engage socially, to engage in the world of work, to engage with your peer group could feel burdensome. So people step back. Sometimes they cause these disorders cause feelings of anger, fear, sadness, and helplessness in the person's experiencing the disorder. So if you have these things happening, the sense of anger, fear, helplessness that you're not quite sure what to do with, then again, people tend to isolate themselves and keep that quiet. It impacts the quality of life because it takes away from a person experiencing joy and experiencing pride and experiencing happiness and experiencing the things that make life life. And so quality of life is impacted. And if you don't have quality of life, you're basically just surviving. They can alter thinking, emotion, and behavior in noticeable ways. And ironically, that is, I just talked about the fact that when people are suffering, they tend to suffer in silence and try to isolate themselves. But it's oftentimes the fact that there have been changes in behavior, changes in their mood, changing in how they behave, that give away the fact that something is going on, sometimes to people themselves and sometimes to people around them who are able to see these things. So a person may realize that a person isn't thinking as clearly or isn't as focused as they used to be or isn't concentrating like they used to. Or certainly behaviors have changed. Whereas they used to be sociable and interactive, then they tend to be isolated and quiet. So the point is that there are thinking and behavior patterns that people are able to identify that could give some insight into the fact that something is going on. And of course, the impact on life is also due to the fact that there is an impact on the health systems of a country. Because when people are suffering from chronic presentations of mental health disorders, they typically don't take care of themselves the way that a person who is not suffering does. So they're not taking care of their physical well-being. They're not taking care of their needs. They're not exercising. They're not eating right. They're not sleeping. They're not doing the things that they need to do to live healthy lives. And so eventually, of course, there is an impact on the body, on the physiology of the person. And so it usually is that people who are suffering from mental health disorders end up with chronic illnesses, end up burdening the healthcare system in a way that would not have happened had they been healthier and been able to take care of themselves. So we all have to take that into consideration. Now, when we're talking about, and I'm talking today specifically, as I said, about depression and anxiety. So when we're talking about depression and anxiety, what aspects of a person are impacted by their presentations of depression and anxiety? So mood is always impacted. So sometimes there's anger, there could be aggressiveness, there could be anxiousness, there could be crying and teary kinds of feelings. So mood is impacted. What else is impacted? Person's emotional well-being is impacted. So people suffering from anxiety and depression tend to feel hopeless, helpless, sad, empty. And these things that I'm naming are not exhaustive. These are just some things in the interest of time. What else is impacted? Behavior. There is loss of interest, loss of interest in doing anything pleasurable, feeling tired easily, and certainly sometimes engaging in high-risk behaviors. So there's a change in behavior. What else is impacted? Sexual interest. So sometimes when a person is suffering from these things, there is not the ability to feel connected to somebody in an intimate way. So of course that speaks to relational problems and relational difficulties. Cognitive abilities are impacted. When we talk about cognitive abilities, we're talking about a person's ability to think, to concentrate, to remember, to interpret, to have perspective. So all of those things are impacted. So sometimes you may be working with somebody and you notice that how they concentrate is off. They're not able to produce and deliver as they once were. All right, so cognitive abilities, sleep patterns. A person may complain about insomnia, just seeing every hour on the clock all night, not being able to rest. Or sometimes the opposite happens, where a person, even sleeping for 6, 7, 8, 9, 10 hours, is tired and lethargic the next day. So sleep patterns are impacted. And basically a person's physical well-being. Sometimes people complain of vague aches and pains that really have no physical connection to anything being wrong in the body. But they're these vague aches and pains that are complained about. And so the body manifests what's going on in the mind and soul of a person. So these are some of the things that are impacted. Now today, as I said, I'm going to talk about depression and anxiety. There's so many other mental health disorders that could be talked about. And even within depression and anxiety, there's so many different types of depression that exist. But I'm going to talk about major depression and pervasive, persistent depression, and I'm going to talk about generalized anxiety because those are the things we see most often. So when we talk about major depression, now remember I said earlier when we started, we're not talking about sadness. We're not talking about a natural emotional response to something going on in your life. So we're not talking about sadness, which is situational, which typically is short-term and which typically resolves itself after a short time. We're talking about major depression, which is a mood disorder. It is the most severe form of depression. So when a person is diagnosed with major depression, that is the most severe form. There are persistent feelings of sadness, hopelessness, and worthlessness that won't go away. So these feelings are not directly related to any specific thing that is going on. They're persistent, they're ongoing, they happened in spite of, and they just happen in spite of what other messages people are giving them about themselves and their capabilities. There are these persistent feelings. What's important when we're talking about major depression is that these feelings have to persist over a 2-week period straight. So if you're trying to get an assessment of what's going on with you, a clinician or somebody who is assisting you would try to get a sense of a pattern of these strong mood feelings. And they have to be over a period of 2 weeks or more. If they're less than 2 weeks, then they could be attributed to something else. But 2 weeks or more of ongoing distress and persistent feelings of helplessness and worthlessness and sometimes suicidal ideation, that speaks to a major depressive disorder. So let's look at some of the things that are included in the assessment to figure out what's going on. If the person is depressed most of the day. Now, usually, if sadness is related to something specific, there are times within the day that the mood changes or shifts based on the other experiences that a person is having. So they may be sad based on something, but they come to work or they go out with a friend or they're able to sit with somebody in their family and the mood changes. So the depression isn't there for most of the day. There is a loss of interest in normal activities. We as human beings are rejuvenated by and fed by the activities that bring us joy and bring us interest. So we are engaged in normal activities. We are engaged in routines that make us feel safe and comfortable. And so when people have lost their interest in the normal activities that once brought them pleasure, once brought them routine and safety, that says that something is going on. Significant weight loss or weight gain. And that comes from the fact that with major depression comes interruptions and interferences in normal eating and sleeping patterns. And eating and sleeping patterns help to regulate weight. Doctors will tell you, even if you're trying to lose weight, if you're not sleeping properly, you're not going to lose weight. So when there is significant increase, so a person is eating too much, just eating without any ability to control that, or not eating at all. They have no appetite and they're not able to put anything in their body at all. That then could lead to significant weight loss or weight gain, and sometimes there is something else going on behind that. So we will look for that in major depression. Sleeping or not being able to sleep. So it's in the same vein of eating. You're either sleeping too much or you're not able to sleep at all. Slowed thinking or movement, just a confusion about how thought patterns and words and the flow of ideas and so forth. Sometimes that slows down because there's so much heaviness in the brain and the thinking and the cognitive patterns that it slows down thinking patterns. Fatigue, low energy most days. You just don't have the energy. One of the most indicative symptoms of depression is just ongoing fatigue, just no energy, low energy. You don't have the ability to get out of bed to do anything. Any of the normal routines, any of the taking care of the children, getting dressed and coming to work, cleaning the house, washing the dishes, nothing. There's fatigue and an inability to do this. Feelings of worthlessness and guilt. So these are persistent feelings that there's something wrong with me, or something that I've done to cause this that's wrong with me, or it's my fault that things are the way that they are, just guilt. Loss of concentration, indecisiveness, recurring thoughts of death and suicide. Now, recurring is the important word to highlight there, because if it is that a person is in a situation where day in and day out for weeks on end, that the thought of not being here becomes a part of their thinking, then that, of course, is a concern. And these are some symptoms of major depression. Now, there's something else, as I said, that I wanted to highlight as it relates to depression. I'm just focusing on two, just because of time constraints. So the other one that I want to look at is persistent depressive disorder. Now, I just talked about major depression. I'm going to talk a little bit about persistent depressive disorder, which is a milder form of major depression, but it is more chronic, it is more long-term, it is more ongoing. So it's milder in that it doesn't have all of the severity and the broad-based symptoms that you heard just now when I talked about major depression. So it's milder, but it's more chronic. The diagnosis, the symptoms must be for at least 2 years. So these are these people who are just habitually, continually sad. Now remember, I talked about the fact that for major depression you have these strong symptoms for about 2 weeks or more. For persistent depressive disorder, you have 2 years of just being sad, 2 years or more. It can affect life more because it lasts a longer period. And it's affecting you for a longer time. It changes how you see things, it changes your experiences. Loss of interest in normal daily activities, again, same thing. Feelings of hopelessness, lack of productivity, and have low self-esteem. So the major difference between persistent depressive disorder and major depressive disorder is that one is milder, you have fewer symptoms, but they are for a longer time. So let's look a little bit at anxiety, which is an emotional disorder. So I just talked about depression, which is a mood disorder, and anxiety is an emotional disorder. Generally, you're talking about a feeling of fear, dread, and uneasiness that doesn't really have a reason, something that you could pinpoint as to the reason why those are there. There are physical presentations like restlessness, tension, and people who are experiencing anxiety often talk about rapid heartbeat, breath, their breathing patterns they're shallow sometimes, or they're fast. Their feelings of anxiety are extreme or last longer than 6 months. So again, different to worry about something specific and something situational. You may be worried about making a presentation, you may be worried about some work that you have to do, and so that response to that is specific, it's time-bound, and it's directly related to your concerns about what you have to do. And it usually passes after that has passed. With generalized anxiety, you have these extreme symptoms that last for 6 months or more, and they're interfering with daily life. You're not able to do some of the things that you ought to be able to do because of this persistent fear that something is going to happen. The feeling of fear, as I said, persists all the time, not just in response to a normal stressor. It prevents a person from doing normal things in life. Again, it could affect somebody at any age. And again, this is why I chose anxiety and depression, because they affect people across the lifespan. And they're more commonly diagnosed in women than in men. The same thing with depressive disorders, more commonly diagnosed in women than in men. So when we look at generalized anxiety, we are looking at things like just increased heart rates. And I'm not talking about just the heart beating a little faster. Just some people describe it, they feel as if their heart is beating out of their chest. It's, literally like that. Rapid breathing, restlessness, not being able to settle and do what you're supposed to do, trouble concentrating, difficulty sleeping. So of course, some of these things sound like some of the symptoms we talked about just a few minutes ago when we were talking about depression. Now, as I said, anxiety and depression are usually co-occurring disorders. Over 70% of people who have depressive disorders also have anxiety disorders, 70%. Anxiety can be a symptom of major depressive disorders. So when a person has been diagnosed with major depression, one of the features may be anxiety, or worsening depression can be triggered by anxiety. So you already have depression, it's getting worse, and it's triggered if there is a situation that is making you anxious. So we see how the two of them coexist and feed off of each other. Both have similar symptoms, namely things like irritability, inability to concentrate and just calm self down, difficulty with memory and concentration, and sleep problems. Now, what are some of the things that can cause depression? Now, I use the word cause. Usually when we're looking at situations and trying to find relationships in our field, we use the word cause when we could clearly say that one thing led to another, which is separate and apart from correlated, two things occurring in the same space. So what are the things that cause depression? What are the things that are there that could lead to a person developing a depressive episode in their life? One is family history. You are at higher risk of depression, of developing depression, if you have a family member who has depression or another mood disorder. So family history. So whenever we're trying to get a sense of what's going on with someone, one of the things we always do is get a sense of the family history. Is there any knowledge that you have of anybody in your family, especially close people, mother, father, aunt, uncle, grandmother, grandfather, any family history of major depression? Another causal factor is early childhood trauma, because when there is trauma before a child gets a chance to be able to, how should I put it, manage that trauma, manage the strong things that come from that trauma. If there is trauma and it's unresolved, or it's not, there's no assistance in managing the trauma, some events affect the way that the body reacts to fear and stressful event. Trauma, especially early childhood trauma, plants itself in the body. The body remembers, basically. And so as the child grows, if the trauma remains a part of their growth, it means then that the body is locked into a particular way of responding to fear and stressful situations. And it's almost impossible to get out of that loop. And so that is one of the contributing factors that we have when we're talking about depression and anxiety. I'll put it there for that too. Brain structure. Now, without going into too much of the biology of the brain, different parts of the brain affect different operations of us as human beings. So some parts of the brains, for example, affect our executive thinking, our ability to make decisions, our ability to think through something and make decisions on it. But certainly as it relates to depression, the brain structure has been found to be a causal factor in relation to depression. So there's a greater risk of depression if the frontal lobe of the brain is less active. And as I said, without going into the biology of the brain, just know that when there is a an assessment made, if there's a neurological assessment made, there are instances where they recognize that the frontal lobe of the brain is less active, and that is a contributing factor to depression. Continuing, what causes depression? There's some medical conditions that cause depression or that put you at risk for depression. Chronic illnesses and chronic pain contribute to depression. And I think, I don't know that I need to explain that. I think that's almost self-explanatory. If you're in a situation where you are unable to perform your normal functioning because of constant, chronic, ongoing pain, it means then that eventually there will be an impact on your mood, because it means then that you're constantly in a loop of having to attend to the pain, adjust your life around the pain or the chronic illness, and it's ongoing. This is not something that happens once and it passes, it's ongoing. And so after a while, without a break, it impacts mood. So chronic illnesses, chronic pains, some thyroid problems sometimes contribute to depression, and that is a physiological function. There's something going wrong with a part of the body, and it influences what happens in the brain, and so sometimes there is that cause for depression. Insomnia, people who can't sleep, it means that you can't rest, it means that your body doesn't get a chance to rejuvenate itself, it means that the body doesn't get a chance to reset, it means that you don't get a chance to step back from all of the day's stressors and anxieties and so forth. And so if you're having insomnia and you're constantly in a space of just revisiting and not being able to sleep and not being able to quiet the mind, it contributes to the depression. Drug use. So a history of drug use and alcohol use is a risk factor for depression. I think that too is self-explanatory. If you're using alcohols, you're using drugs, it means that you are diminishing the quality of your life, it diminishing your ability to function in a family setting, in a work setting. You're taking away the social structures, the structures that nurture, the structures that contribute to resiliency. You are separating yourself from those, and of course it means then that depression is a high risk. There are certain medications that contribute to or that enhance depression. Extreme and ongoing stress. Now, how our body is intended to function is that there is an intended response to a stressor. The body prepares itself for the stressor physiologically and emotionally. The body then responds to the stressor and then gets a chance to come down from that stressor. So it means that the physiological response and the psychological response that has been mounted in the face of a stressor is then relaxed after the stressor passes. But when there is extreme and ongoing stress, the body, the mind, the way that we think, the emotions don't get a chance to retreat and to come down. And so there is ongoing stress, and ongoing stress then impacts a person's ability to regulate, and it impacts mood. And what are some examples of ongoing stress? Loss of somebody who is dear and close to you, especially if it's unexpected loss or traumatic loss, all right? Ongoing economic and financial pressure, and we are in a COVID era for about almost 2 years now, where for many people, their livelihood has been lost, and there are real stressors as it relates to their economic and financial stability. And so, you know, having a person in a situation where there may be no end in sight for them, there may be no ability for them to anticipate when things will change, there is nothing, so it's ongoing stress. That contributes very heavily to depression. There is something else that contributes to depression, and it's called distorted thinking. Now, all of us have thinking patterns that help us to manage situations. But there are distorted thinking patterns that actually contribute to mood disorders and episodes of depression. And what are some of them? Catastrophic thinking. Catastrophic thinking is that thinking that the worst thing that could happen is going to happen, even out of something minimal. So if I didn't do what I needed to do today in school, that means that I am going to fail school, I'm going to drop out of school and become nothing in life. That is an example of catastrophic thinking. It takes a situation and foresees and focuses on the worst case scenario that probably isn't even going to happen, but that is the focus. Discounting the positive. So that is a situation where the person hones in and focuses on that one little thing that could go wrong and absolutely neglects or forgets about all of the other things that have been going right, that are going right, and that could go right. So the focus is on, but what if? So this is a bright sunny day and outside is blue sky and everything is fine and we're going to go outside for a picnic. And way in the across the horizon, I see a cloud with a little grain in it, and the focus then becomes, but it's going to rain. So we're here and we're wasting our time because it's going to rain. Discounting the positives. Emotional reasoning. Now, all of us are emotional beings, but we are also rational and thinking beings. So emotional reasoning puts a person in a space where their response to something and their ability to manage it comes through their emotions only and not through their ability to think through and rationalize it. So of course, if you think about it that way, you'd recognize that for us as human beings, emotions are sometimes volatile, they're changing, they're up and down, they are seesawing. And so for people who respond or who use their emotional reasoning only to manage situations, you could imagine then that it has them all over the place. It brings a level of instability to how they see things and how they manage things. Labeling or mislabeling. So labeling and mislabeling has to do with looking at a situation, interpreting this is what is going on, and making your decisions based on that interpretation. So I could be walking on the street and someone passed me and didn't say good morning, and my interpretation is they didn't say good morning to me because they don't like me anymore. We used to get along and we don't get along anymore. So because they haven't said good morning, it must mean that they don't like me anymore. So that's a mislabeling of a situation. Mental filtering. Mental filtering means that, again, it's similar to discounting the positives. You filter out the things that you don't want to focus on, and you let come in the things that fit your perspective or the perception on the situation. So you filter out, even in terms of, even in the light of proof that says different, you filter that out and you remain with the perspective that says to you, or that feeds your misunderstanding of the situation. Jump into conclusion, that speaks for itself. If this happens or if you do that, then that must mean that. Overgeneralization. Overgeneralization is when you focus on words like all or everybody or it's always or everything. Words that speak to just having a general sense that everything looks the same. That's overgeneralization. Personalization, that speaks to when you see everything that happens around you as an attack on you. So somebody is late to come to do something for you, and the personalization is that they always come in, they're always wanting to upset your day because they're late. They could be late because they had a car trouble, or they had issues with something at home. They were leaving home and their plumbing went down. But a personalization approach is when the person says, oh, they always want to interfere with my day and make my day go awry because of something that they've done. Polarized or black and white thinking is either or. Either I'm good or I'm bad. Either I'm successful or I'm a failure. Either I'm going to get this done or I'll be the laughing stock of everybody. Polarized thinking. And should statements. Should statements are statements that infer that there's only one particular way for something to happen. So I should always be perfect. I should always get everything right. I should always be the person who says yes. those should statements are problematic. So I just looked at some distorted thinking patterns, and I just went through them in a very cursory way because you really could get into some detailed discussion on these. But I just looked at some distorted thinking patterns that contribute to depression and anxiety. And I don't think I have to explain why they contribute. But I will say that I think you could clearly see that they contribute to depression and anxiety because they set up the person to receive things in a particular way, to receive things in a very structured and strict and rigid way, so that there's no other way of interpreting a situation or interpreting an experience. And if you're not interpreting a situation or an experience or time spent with somebody, if you're not interpreting it in a broader way and allowing yourself to see all of the possibilities, then you're setting yourself up for ruminating, ongoing thinking, which then contributes to feelings and then contributes to how things impact you. So just like how we looked at what causes depression, let's look at what causes anxiety. People are not so sure, the researchers in this field are not so sure of the exact cause. But there's some thinking that it may be a combination of genetic factors and environmental factors, as well as brain chemistry. So basically some of the same things we talk about when we talked about depression. Genetic factors, environmental factors, your socialization, what your social structure is, what your life is like, what your stresses are, as well as brain chemistry. Now, research shows that the area of the brain responsible for controlling fear may also be impacted for whatever reason. And so that makes it difficult for a person to regulate fear and regulate things and regulate how they see things and bring it back down to a point where they're able to manage. So that may be a factor. As I said, they're not sure of exact causes, but they know that these are some of the things that are correlated. Now, when it comes to treating anxiety and depression, this is where I think we have good news, because there are some mental health disorders that are resistant or more complicated to treat. But anxiety and depression are very responsive to treatment. And that may be because there's been so much work done on ways of treating anxiety and depression. So certainly as it relates to the drugs that treat anxiety and depression, there is a lot more efficacy in the drugs now. They do what they say they do. There's always testing and retesting and making the drugs better. And certainly there are a lot of therapies that have been proven and tried and proven again to help with anxiety and depression. So anxiety and depression are very responsive to treatment. So that's good news, because it means that it's not a sentence for loss of quality of life. Medication management for severe cases, medication management is for severe cases. So you have medications that deal with your antidepressants that deal with your mood. You have anti-anxiety medication and antipsychotic medications that, as I just said, over the years there have been more and more improvements made in these areas, and so they're very effective. So medication management and the therapy that is used to help people deal with anxiety and depression are very, they're tried and true. So certainly as it relates to therapy, therapy is helping people to learn skills to cope with negative thoughts and feelings, because anxiety and depression is about changing the management of how you think about things and consequently how you feel about them. So just to name a couple of therapies that I use today that are very effective, CBT, that is probably one of the most effective therapies that is used with anxiety and depression. CBT is cognitive behavioral therapy, and basically cognitive behavioral therapy recognizes the link between your thought, which then leads to how it impacts your feelings, and of course feelings impact behavior. So thought, feeling, behavior. So in the CBT approach, the cognitive behavioral therapy approach, the focus is on addressing some of the distorted cognitions, the distorted thought patterns, the distorted ways of interpreting things, the distorted perceptions you have, so that those could be changed, so that of course if those are changed, then of course the feelings you have about something changes. And if the feelings change, then the behaviors change. So that is CBT therapy, very effective. You have something like mindfulness therapy, which is again very effective in dealing with depression and anxiety. And mindfulness has to do with bringing a person into focusing on the here and now, rather than the past and what should have been, or the future and what might be, which we don't have any control over. So it really is a focus on getting the value out of now, about experiences now, about relationships now, about capabilities now. So it really is about honing in on what is happening now. And then there is dialectical behavior therapy, which has to do with challenging extreme thoughts. Dialectical behavior therapy, which is DBT, is used to, is really used a lot with people who have perhaps more persistent and ongoing thoughts and moods that affect them. So it really is about honing in on some of these rigid thoughts that are difficult to shift, and really just pushing and focusing on changing those. So those are some. Of course, as I said, this is not exhaustive by any means, but we just have a few minutes here just to explore in a very superficial way some of the things. So when we're looking at treating anxiety and depression, not everybody is going to go to a therapist or need to go to a therapist. Not everybody is going to need antidepressants. Not everybody is going to need anti-anxiety medication. But what everybody can do on a regular basis is to have control over their lifestyle. So lifestyle changes are very much encouraged to be able to help to manage anxiety and depression. And so when we're talking about lifestyle changes, what are some of the things we're talking about? We're talking about things like keeping a journal. We're talking about things like getting involved in a hobby. We're talking about things like volunteering, because all of those things, by the nature of what they are, especially the volunteering and hobbies and getting involved in other things, you take a person from their internal world where they're just stuck with their thoughts and their feelings, and they push them out. So they have the possibility of having different experiences that then lead to different thoughts. Exercising, 30 minutes of physical activity 3 to 5 days a week helps. In fact, one of the things that people are encouraged to do when they're suffering from mild depression, even major depression, but depression just generally, one of the things they're encouraged to do is move. Move for 30 minutes a day, because there actually is a chemical receptor in the brain that releases through physical activity when there's physical activity going on. So it's almost like the brain has its own natural feel-good drug that is released when there's movement. So physical activity 3 to 5 days a week. Avoiding alcohol and drugs, certainly in any excessive way, because as I said before, that just exacerbates depression and anxiety. Learning to say no. So that's one of those lifestyle changes. That has to do with social connections. Sometimes people have this thought pattern, I just talked about distorted thinking, this thought pattern that says, if I say no, then that must mean I am not a helpful person, I am not a kind person, I am not a person who is willing to give. So people then sometimes have the inability to say, no, I'm not able to extend myself anymore, I'm not able to do this at this time. So being able to say no. Changing the distorted thinking, and we talked about some of those. Self-care. Self-care physically, emotionally, mentally, spiritually, socially, financially. We are one human being, one person with many domains. We are a physical person, we are an emotional person, we are a mental person, spiritual, social, financial, intellectual, all kinds of things. So self-care, physically, make sure you take care of your physical needs, do that walking or that movement, drinking lots of water, hydrating properly, being able to get some rest, eating when you should, eating on time, eating properly. Physical self-care, doing yoga, meditations, that actually takes care of your emotional as well as physical self. Emotional, being able to manage feelings properly. Now notice I didn't say being able to push away feelings or not have feelings, but being able to manage them. So what I mean by that, I mean that as human beings, there are going to be different feelings that people have that are normal in relation to normal life situations. So the goal of life isn't always to be happy. The goal of life is to know how to manage stress, how to manage frustration, how to manage hurt, disappointment, anger, fear, pride, everything. So self-care comes with being able to honestly tap into some of the feelings that you have about something in relation to an experience maybe, and being able to express those or manage those in a healthy way. Mental, and that has to do with cognitive, being able to put and feed uplifting thought patterns. Uplifting thought patterns are patterns that say to you that you can. Uplifting thought patterns are also realistic ones that say, well, if you're not able to, that's okay, that's not the end of the world. So those kinds of things. Spiritual, you have to be connected to a bigger picture, because with all of the stressors that a person goes through, they have to be able to connect to something else that says, even though I may not be in control of this situation, there is a bigger entity, there is a bigger system that is in control. So even if I can't control this particular time, it is going to balance out. And I'm using my words carefully, because spirituality doesn't mean religiosity. It means being able to connect with nature, being able to connect with something more soul nurturing. All right, so we are spiritual beings. Social, we have to be able to form and make relationships that are nurturing to us. I don't necessarily mean, or I don't mean at all, that a person have to have 10 friends, 100 friends, a person has to go out every weekend, a person has to spend time always engaging in activities with people. Social has to do with your connection to people who are important, people who nurture you, people to who you give nurturing, people that help you form resiliences to be able to manage some of the stresses of life. And financial, you have to be able to manage monies, you have to be able to manage how your money flows, what goes where. You have to be able to have some control over that, as little as it may be, as much as it may be. Just financial prudence, financial control is important in self-care. Reducing your stress, now to manage your time. And I go back again to being able to say no when you have to say no, and say yes when you can say yes. Building strong relationships, doing things like meditations and yoga, avoiding too much caffeine. I mean, these are just some of the things that are lifestyle changes that don't require any sort of in-depth therapeutic alliance, but they're things that people can do on a regular basis for themselves every day to make sure that they take care of themselves. So at the end of the day, what I want to leave you with is the fact that depression and anxiety are real things that people experience. They are co-occurring, but they don't. You don't have to live in a world that is sad, that makes you feel helpless, that makes you feel out of control. You have the ability, as you manage your depression and anxiety, as you manage yourself, as you get help, as you seek help, you have the ability to smile. You have the ability to come through this. You have the ability to have the kind of life that you want. And I just want to close it off by saying there is always help available. So even if you just want to have some insight into something that may be going on with you, there's so many places that you can use as a primary entrance into that awareness. You could talk with your doctor. People will go to their doctor before they'll go to a psychologist or a counselor. You could talk to your doctor. Doc, these are the things that I'm feeling. And a doctor has basic understandings of trying to be able to find out some of the primary things. So talking with your doctor. There are nurses in the health centers all around the island that you can speak to, and they also have that same ability to identify if something more is going on. There are mental health counselors at the National Counseling Center. There is psychological services at the Jane France Hospital. There are guidance counselors in schools who parents can talk to about concerns they have about children. So the point that I'm making is there's always an entrance point somewhere to be able to connect and have conversations if you are concerned about your own well-being. So today we spent some time looking at depression and anxiety. I hope you were able to get something from this that allows you to walk away this afternoon and think a little bit more, think about somebody you know, think about your own situation, and hopefully it leaves you also with a sense of the fact that there's always something that can be done. Thank you very much for having me. Thanks for listening.
Thank you so, so much, Mrs. Blake, for gracing us today with your presence and such an informative presentation. Thank you so much. Um, Lastly, but definitely not least, we will be moving on to hearing a testimony, or testimonial rather, from Dr. Kamara Louisi. Louisi, yes, she hails from Nevis. She was unable to be with us here in the flesh, unfortunately, so she sent us a video that we are going to play for you guys. We know that persons who may have experienced challenges as it relates to mental illness, we know that there's a stigma and it's something that we don't usually talk about. But we were lucky enough to get Dr. Louisi to assist us in that regard and share her testimony. She is a survivor of clinical depression and suicide. So we're gonna roll right into her presentation at this point. Stay tuned.
Hello, I hope this video finds everyone well. Thank you for the St. Kitts Cooperative Credit Union for inviting me to speak about my experience. I am Kamara Louisi. I'm a veterinarian with the livestock unit of the Nevis Agriculture Department. Okay, so let's get into the heart of it. Um, Statistically speaking, globally, at least 1 to 2 out of 5 persons will experience some kind of mental health issue during their lifetime, which means that somebody in this room might be going through something that might not be obvious. They might be in denial, or they might know that something is wrong and they need help, but they're afraid because of the stigma that is attached to mental health issues. Now, understand that having a mental health problem is not just the quote unquote crazy person on the side of the road that, acts out and says all kinds of random stuff and so on. Mental health issues come about because of several factors. You could be born with it, you could experience trauma, such as, a loss in the family, financial issues, rape, abuse, witness something, um, have lost a baby through a miscarriage, and several other things that can contribute to it. Health wise, physiology wise, it can be caused by PCOS in women, thyroid issues, prostate issues in men, anything that messes with the hormones, right? High blood pressure, diabetes, cancer, these things. Okay? And so there are many people that are walking around that look well kept together, like they have their lives together, but when they get home, they break down. That's what you don't see. Or they have panic attacks. They get triggered, and so they don't know how to react, so they shut down. And unfortunately, that has happened to me. So let's get down into my story. Right. Um, I was predisposed to depressive tendencies from a child. From since I was a child, I was bullied, had some, not healthy family dynamics, and so I was sorry, predisposed to that. Right. Okay. And then coming into going off to university, I got involved in a relationship that was not healthy. It was abusive, verbally, mentally, emotionally, financially, sexually. Um, Not physical blows, but I like to tell people that they don't have to hit you, and it's the mental stuff that lasts with you longer. And in that relationship, I got pregnant. I tried to get out of it, but I was not in the right mental frame of mind to stay out of it. And I ended up pregnant with my daughter. And it was during my pregnancy that I attempted suicide for the first time. I was in a real dark place, real bad. Um, but fortunately, it didn't happen. I had my daughter. And after I had my daughter, then I started to feel real down, couldn't sleep. The suicidal ideation was there and so on. So I decided, okay, let me see somebody about this. So I went and I saw a psychiatrist, and he diagnosed me with postpartum depression, right? And it's like, okay, you're gonna need to go on medication or whatever it is. And I got back home and I told the person I was in a relationship at that point in time, this is what the case is. And that person, along with other persons, like, nah, nothing wrong with you. You'll get over it. It's just the hormones from the pregnancy. It's all in your mind. Nothing is really wrong with you, and all that kind of stuff. Fortunately, I got out of that relationship and I moved back because I wasn't living in Nevis at the time. I moved back to Nevis and I started teaching. And I'm sure some of you would have experienced being in a workplace or environment where certain people have all the workload and then there are other persons just traipsing along with hardly anything to do. Yeah, that was my situation during teaching. And so that contributed to my condition that I didn't deal with properly. And so I started having physical issues, panic attacks when I got near the school, migraines, aches, pains, stuff like that. And I was like, no, 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 no. So I was trying to fight it, and I became extremely irritable to the point where when I would get home, I would, shout and, get at my daughter and everything else. And my mother had to pull me aside and be like, that's not working. You need to cool out and everything else. So I tried my best, right? And then I went off to school again, this time to vet school. And during this time, my daughter went off to see some relatives, and some things happened. And when I found out about them, I did not know at that point in time whether my daughter was a victim or not. And so, as a mother, I lost my shit and I had a complete, excuse my French, had a complete mental breakdown. Shush! To the point where I had to repeat a semester. Fortunately, she was not harmed or anything like that. But in that moment, in that time, you're a mother away from your child, you don't know what's going on. So yeah, I lost it. Yes. So then I came back to Nevis to work and was working, opened up, started my own business and everything. And then I started to get more migraines, body fatigue, insomnia, weight gain, weight loss, period irregularities, hair started thinning in certain areas, and so on. So I'm like, no, no, no. So I went to my general practitioner and we did a slew of blood tests and everything else. And it's like, okay, thyroid seems to be having issues right about now, and thyroid problems run in my family. So that's something that I'm already another thing I'm predisposed to. Right. And so after that, he sent me to see a psychiatrist, and then I did the evaluation, and she's like, yeah, you have depression and anxiety and so on. So I'm going to put you on medication. This is what I need you to do for yourself, and also see a counselor. And so I was doing that, change up my diet, exercise, and feeling good about myself and everything else. And then I got into another relationship. And this person, again, was like, no, you don't need the medication. You don't need to do this. You just need to do that, or whatever it is. It's all in your head and stuff like that. And so I stopped looking after myself, right? I stopped looking after myself and I fell into that relationship mode. And
once again, I got it chipped away at piece by piece till I found myself in a situation like, I don't know how I got here. And then when the relationship ended very badly, and I was already in a bad position physically, health-wise, mentally, financially, and everything else, I lost it. I had a breakdown, and once again, I attempted to take my life. And unfortunately, my daughter witnessed it, but she didn't understand what was going on. And so she thought I was just sick, that I had passed out from the flu or something. And I had written up, I think, a 7 or 11 page letter to all my family and friends and everything else. And after they got it, they were calling me, panicking and everything else like that. But fortunately, once again, that was not successful. And then I went into what you call mental health boot camp, where I decided this is not going to happen to me again. I will do everything and anything in my power not to find myself in this position again. Right. So once again, back to the psychiatrist, counselor, changed up my diet, started on supplements to help my mental health and my thyroid, journaling, meditation, doing more stuff with my daughter that we enjoy doing things together, focusing on my business, which is like animal based. I love dogs and cats and so on. That's the highlight of my day. So that has helped me. And having also supportive people who, even though they may not understand exactly what's going on, when they realize that I'm getting into a slump or a habit or whatever it is, they're quick to point it out and pull me up on it so that I can figure my stuff out and reset, right? Going into myself, spirituality, and notice I said spirituality and not religion, because unfortunately I have had personal experience and persons have come to me saying that, when they express these things to people in the church and so on, it's, oh, you're possessed or the devil and all these kind of things, which makes the situation worse. So me being spiritual is that I go into myself and find the power within me to understand that no one else controls me and that I am responsible for my recovery and my healing, and not to focus or put blame on anyone that has been in my life that has done things, to focus on me. Right? And that has helped me tremendously. Basically, and they call it addressing your dark side, your shadow work, right? Where you come to terms with all the bad things and negative things, and you see how even though they happen, they contributed to you in a positive way. It might not have been the best way, right? And then you focus on becoming a better person. And that is what is very important to me. Do I still take medication? Yes, especially because of my thyroid. It comes, it goes, it does all kinds of stuff. So sometimes I'm there, I'm fine. Next day, I can't get up out of bed. I'm achy all over, migraines, weight gain, period fluctuations and issues again. And it goes and comes. But when these things happen now, I don't judge myself. I don't come down on myself. I understand and I deal with them one by one, bit by bit. Okay? Now, there are persons who would be in denial about what they're feeling, what they're going through. And there are persons who would know that, yes, something is wrong, I need to get help. But there are persons around them who are going to discourage them and say, oh, it's all in your head. Oh, you'll sleep it off. Nothing really wrong with you. You're just having a bad day and stuff like that. And especially with COVID times now, so many people are going over the edge, drinking, drug use, gambling, a whole set of addictive behaviors. And my addictive behavior actually was overworking. So I would work, and then crash. And that was so that I wouldn't face and have to think about all the stuff that was tumbling around in my head. Right? And I've gotten out of that. Sometimes I still fall back into it, but then I have persons who pull me back and be like, you're going, or you're doing too much, you need to go and rest, or you're getting irritable, go and cool out, stuff like that. Right? And I am fortunate, but not everyone is so fortunate to have a good support system. Okay? And if you don't have it, There's nothing wrong with that. Seek out help for yourself. You'd be surprised that when you start seeking out help for yourself, whether it be through the therapist or a close friend or maybe a church member, one person. I tell people you just need one. You just need one person. And then that one person will open you up to other people who are going to be supportive of you. And you'd be surprised that sometimes the persons who bring you down the most are your own family members. Yes, I know this, right? Yeah. And it's okay to say bye and to love them from a distance. That is something that I have learned and that I am doing, right? And then keep my support circle very small and intimate. Okay? So, with all that said, if you're going through anything, you're going to have good days, you're going to have bad days, but always remember it's temporary, right? Don't let your thoughts fool you. We are our own worst enemy, but we are also our own best friend. Okay? So if you see someone who might be struggling, they're withdrawing themselves, which is something that I did from friends and family. If they stop doing things that they enjoy, if they're just saying, I'm so tired, if you realize that something is off, like they're smiling one minute, but you see them down, or they're complaining about aches and pains and other stuff, help them seek help. And sometimes it doesn't have to be anything large. Go for a walk with them. Help them with something in the house. Help them with the children. Go for a walk. Just talk it out. Do something that's fun. Get them out and away from that mindset that they might be falling into. And you'll be surprised, okay? And for yourself, if you're going through anything, and for those persons who are in the support group, remember this. Everyone is going through something. You never know what they're going through. And it's okay to not be okay, right? Love yourself, show yourself compassion, be empathetic to other people, no judgment, no gossiping, or anything like that. Sometimes a simple hug is all someone needs. All right. And I know I went over time with this. It's supposed to be 10 minutes, but there's a lot, right? So I hope I have been helpful. And I hope that, you're checking on your strong friends, persons who look strong, but they're dealing with a lot of things. Just be there for each other. And that's what I would advise everyone and everyone to do. Be there for each other and always be kind.
Wow. Thank you so much, Dr. Camaro Louisi, for that informative, very personal testimonial. And we think that persons could relate more to a personal story. And she backed up just about everything that Mrs. Blake informed us on this evening. So thank you again, Dr. Kamara Louisi, for that presentation, and also a special, special heartfelt thank you to Mrs. Blake, Mrs. Michelle Blake, the director of the National Counseling Center. And if you're experiencing any of these symptoms, you're not sure what's going on, you need someone to talk to, feel free to call at 465-5000 and they will be able to assist you. Very confidential, private. You don't have to worry about any unprofessionalism. All right. So thank you so much for joining us this evening. And it's a wrap. Have a good evening. Bye.